So are there particular phone habits that could possibly cause more harm than others? Well, there's more research going on into this. I asked Dan Joinson from the University of Bristol about his study.
Yes, so my research is all about looking not at how much people use social media, but instead how they're using it, what they're seeing on it, and when they're using it. So I'm a researcher at the Children in the 90s study, in which, because of the trust and the time of participants, which we're really grateful for, we were able to collect and link data directly from Twitter or now X.
And you've been looking specifically at nighttime use, haven't you?
Yes, so the relationship between the time of day people use or post on Twitter and their mental health. And what we found is evidence that people who on average were more likely to post on Twitter between 11 p.m. and 5 a.m. showed worse mental health, which could be driven by late night use of social media delaying or disrupting sleep, or if people with pre-existing mental health problems are more likely to stay up later at night using these platforms.
Why do you use X in particular?
So two main reasons for this. The first being a practical one, that when we started the research, Twitter was the platform where it was easiest for researchers to get access to data from, which is important so we can precisely and accurately look at what people are doing on these platforms and the experiences they have. But also it's really important to look at things like nighttime use across a whole range of platforms, because a site like Twitter, where it's highly interactive, people can message users, reply to users, post content, the impact of late night use might be different from more passively consumed platforms like YouTube or TikTok.
So how do you hope that platforms might use your research?
Well, I think two main areas. The first being that we need more research in this area. We're one study that builds upon research that has shown potential harms of late night use. But ideally, we would work with social media platforms using the valuable and important data they have to explore potential harms like nighttime use. But also there is some evidence of platforms changing their design and features around this. For example, TikTok recently introduced a new tool called Wind Down, which for users under the age of 16 after 10 p.m. replaces their For You page that usually contains videos with calming music and meditation content.
Beneficial tweak. Dan, thank you very much for sharing that research with us and for keeping this conversation going. It's important, isn't it?
Thank you.
Thank you.